Time now for a look at your health, and your health in the summer could be at risk if you're not careful. Dr. Mitchel Goldman from UCSC is here to explain the top summer health risks and the warning signs of heat stroke. So thank you for being here.
Great to be here.
Well, aside from skin cancer, which we hear a lot about, and heat stroke that we, usually try to keep an eye out for, what are some of these summer health risks?
Well, one of the other risks that we really haven't spoken about a lot is your eyes. We have an epidemic of cataracts, and so although we know we have to use sunscreen to prevent sunburns and skin cancer, we always really need to protect our eyes as well, so wearing sunglasses with ultraviolet protection is important.
And swimming in water that's too hot, why is that an issue?
It first came out in Olympics and in long distance swimming. When swimmers are competitive in hot water, because our bodies will literally dissipate heat into the water very quickly, if you're really working up a sweat underwater, you can actually lose your body heat very, very quickly and actually get more heated up inside, and that can produce heat stroke in the water. When that happens, if someone faints on land, it's okay. If they faint in the water, they drown.
Wow. And dehydration is kind of self-explanatory as a summer risk, but is food poisoning simply food being left out in warmer temperatures?
It really is. Now, when we have potato salad or anything with mayonnaise in it, you really cannot leave that out. And so when we're enjoying our wonderful weather, especially if you're at the beach and you don't have your food in a cooler, if it's warm when you start eating it, it's going to start getting rancid. And so you have to protect your food as well, because we see a lot of nausea, vomiting, and stomach-related injuries.
And we should just add, Dr. Mitchel Goldman was telling me during the commercial break, remind you not to keep the kids in the parked car, or of course your pets either, because that's overwhelming. Which leads us to really the symptoms of heat stroke. What should we be looking out for, the signs that something's going wrong?
Well, first of all, heat stroke is really dangerous in the young, those up to 4 years old, and the elderly over 65, because they're not able to really tolerate heat too much. If your body temperature goes much above 105 degrees Fahrenheit, that's when you're going to start to get the symptoms. First symptoms are headache, nausea, vomiting. Sometimes you feel faint. Those are the easy things. And once your skin starts getting bright red, once you stop sweating, that's a really big dangerous sign. So if someone is feeling like that, starting to feel a little loopy or not be all there, call 911. Get them into a cold room. Apply ice packs in an area of their body where there's a lot of blood flow, like under the arms, in the groin, on the head, and try to cool them down, because cooling someone down is very, very important.
It sounds like almost it requires the kind of quick response that somebody who's undergoing like a heart attack.
It really does, because again, once your temperature gets above 105 degrees core body temperature, lots of bad things happening. Our bodies, our enzymes, our normal bodily functions don't work. Next thing that happens is arrhythmias in the heart. So enjoy our wonderful weather, enjoy being in San Diego, drink plenty of fluids, wear sunscreen, eat your food before it gets rancid, and then make sure you stay cool.
All right, thanks so much, Dr. G.
Good to be here.
Let's throw it over to Walter.